Hello and welcome to Threefold Herbal Healing. I'm Herbalist Leosade. I help people who struggle with chronic conditions grow their health from the roots up. Today I'm talking about uterine fibroid, a, a condition that is common in many women. Many women experience heavy bleeding and painful menstruation every month, and they are not connecting the dots and are unaware that those symptoms are not normal and could be a sign of uterine fibroids, a benign growth of the uterine muscles that can occur in the uterus itself, but also outside of it. Uterine fibroids and heavy bleedings are caused by excess estrogen. The number of estrogen and progesterone receptors on the fibroids themselves is way higher than on normal uterine tissue and uterine cells, making the tissue highly sensitive to the proliferating action of estrogen, and that's why you get all this grow and proliferation. When you expose yourself to estrogen, you increase your risk of uterine fibers. So how do we expose ourselves to estrogen? Using oral contraceptive, expose yourself to estrogen. Chronic alcohol use increase estrogen because alcohol increase estrogen. Exposure to xenoestrogens increase estrogen. Estrogen, I'm going to talk about them in a moment, so you will get the picture. Obesity, double and triple your risk of developing fibroids. Why? Because fat tissue is not a passive tissue. It's actually endocrine tissue that releases enzymes and hormones. And it's releasing hormones that converts androgen substrate of sex hormones into estrogen. So you get an increase in estrogen levels in your blood. And dysbiosis. Dysbiosis is an imbalance in your gut bacteria, increases the rate of gram-negative bacteria, the bacteria that unlock the binding between estrogen and bile, and increasing estrogen reabsorption in the body. So really what is happening is that you produce estrogen between day 1 and day 14 of your cycle normally in your ovaries, and that's the normal cycle. Once the estrogen did its job and it needs to be eliminated from the body, it is shuttled to the liver. The liver break it down in 2 phases and then bind it to bile. The bile carry it through the small intestines to the colon and eliminate it in the stool. Two things happen in dysbiosis. One thing, when you have dysbiosis, you have gram-negative bacteria, and that gram-negative bacteria break the bind between bile and estrogen, and then estrogen is in the system and it can absorb back. But also dysbiosis slow down your motility. So you have constipation, and this bile with estrogen stay longer in your body, and then it's being absorbed back into the blood. Now, most women actually have small fibroids in their uterus. It's very common. However, for some women, fibroids come with really heavy bleeding, leading to anemia, fertility issue, painful periods, painful intercourse, urinary frequency and urgency because the fibroids are putting pressure on the bladder, and disruption to bowel movement because, again, the fiber might put pressure on the sigmoid colon and disrupt the healthy flow of stool out of the body. Uterine fibroid typically reduce in size once estrogen level decline in menopause. So many women in their 40 and 50 start to see reduction in the amount of bleeding and in the cramps. But if you are a younger woman in your 20s and 30s, and every month your cycle is very heavy with really painful cramps. Maybe you even need to stay in bed for a day or two, waiting until you're 50 and you got into menopause. It's not really realistic for you. So what does conventional medicine has to offer us? Conventional medicine offers ablation. It's a surgical removal of the fibroid using either extreme heat or coldness. However, those interventions do not solve the problem because they don't address the underlying hormonal imbalance. So what really happens is that you do the ablation, but a year or 2 or 3 after, it's the entire process start again because you are still estrogen dominant. So how do you reduce estrogen? Estrogen is a growth hormone. Its role is to thicken the uterine walls in preparation for a fetus. Estrogen promotes the production of tissue and blood vessels, which is good if you're trying to get pregnant. It's functional, it's important. Fibroids are a sign of estrogen dominance, which means that either you have a high levels of estrogens or you have a low level of progesterone. They're reproductive hormones that balance estrogen. Progesterone thin and smooths the uterine lining. So it's kind of cause some shedding of that excess tissue. So when you think about reducing estrogen, you really want to have like a holistic worldview and kind of bring together a couple of components. You want to start by reducing xenoestrogens. So I promised I'm going to talk about it. What are xenoestrogens? Those are synthetic chemicals that mimic the effect of natural estrogen in the body. So those are chemicals that comes into the body and bind to estrogen receptors and activate them in the same way that estrogen does. And some common source of xenoestrogens are hormones fed to animals. So if you have beef or chicken that was fed with estrogen hormones for growth, because that's what they use to mature the animal faster, then you're taking in all this estrogen, pesticides, plastic, some cosmetic products, and HRT drugs. So once you did that and you took care of all your xenoestrogens, you want to support your liver detox pathway of estrogen. As I say, estrogen, after it finishes its functional role in the body, is shuttled to the liver, goes through phase 1 and then phase 2 detox, then it's bind to bile, go into the small intestines, colon, and eliminated from the body. How do you want to do it? If you eat bitter food or use bitter herbs, dandelion is a good one to think about. Artichoke is another one. Those are herbs that increase bile production. So add them to your diet, but also bitter foods. You can eat vegetables from the cruciferous family that potentiate the phase 2 liver detox. So we are talking about vegetables like broccoli, cauliflower, cabbage, Brussels sprout. Try to eat them regularly. You want to include food that is rich with polyphenol. Polyphenols are foods that have color like blueberry, raspberry, pomegranate, and olives. They help counteract the oxidative stress that is associated with the detox process of estrogen. And by doing so, they prevent and reduce inflammation in the body. You want to heal your gut and support a healthy microbiome. Obesity and dysbiosis feed each other, creating a vicious cycle and increases estrogen and increasing inflammation and reducing elimination of estrogen. So how do you do it? You want to add fiber to your diet. Half a cup of leafy greens in into your daily meals. You want to add probiotic, fermented food. Those will also drive your motility, so you will have more regular bowel movement and you will be able to eliminate estrogen more regularly. You want to reduce simple carbs and processed food because they are inflammatory and inflammation will increase estrogen. You want to increase your intake of soluble fiber from fruits and legumes because again, it will increase motility. And you want to add probiotic, especially fermented food if you're not histamine intolerant. Like I said, inflammation increases estrogen in the body. So you want to reduce inflammation. Fibroids are inflammatory, while chronic sustained inflammation may create environment that promote abnormal smooth muscle proliferation and maintain it. So reducing inflammation is crucial for maintaining a healthy gut and achieving a balanced reproductive hormones. To reduce inflammation, you might want to think about adding half a pound of cold water fish twice a week to your diet. Adding fish oil. You want to avoid red meat and ham. You want to add vitamin D and maybe 2 Brazilian nuts daily because again, Brazilian nuts contain a lot of selenium and selenium reduce the oxidative stress that is associated with the detox of estrogen. Some research suggests a connection between mind and body in the case of uterine fibers. I talk to people that say that uterine fibers are connected to trauma. It's not backed by science, but it is obvious that heavy bleeding and pain are stressful by themselves. So you want to manage your stress. If you manage your stress, all your symptoms will be reduced. You want to block estrogen receptor with phytoestrogen. So what are phytoestrogen? Phytoestrogens are plant-based compounds that can bind to estrogen receptors. They block the receptors, so estrogen cannot bind to those receptors, but their effect is much weaker than estrogen. And they help balance estrogen metabolism and support overall hormonal balance. So some phytoestrogen to consider are red clover, hops, soy, and legume. Another way to work with reducing estrogen is stimulating blood flow and lymphatic drainage. So you can do castor oil pack on the lower abdomen or myoabdominal massage can relieve some symptoms and improve your quality of life. If you're anemic, which I think, I don't know percentage, but a lot of women in fertility years are anemic because they lose blood every month. And if you have uterine fibroid, you lose large volume of blood. So the chances that you're anemic are really high. Consider supplementing with heme iron. So let's talk about herbs for uterine fibroids. You want to use styptic herbs that can help reduce the heavy bleeding. Those herbs really reduce, or even, and you also want to use antispasmodic herbs. Antispasmodic herbs are herbs that relaxes the muscles. So you relieve the cramps. So two styptic herbs to consider are yarrow and cinnamon. And antispasmodic, think about crank bark, lobelia. You also want to use alternative herbs. Alternative herbs change the lymphatic flow through the body, and they release stagnation and metabolic function. They kind of, and really, there is a lot of stagnation and congestion associated with uterine fibroid. So some of the herbs you want to consider are red clover, burdock, and violet. So let's talk a little bit just about cranberry because this is the herb that I want to highlight this week. Cranberry is a uterine tonic that increases uterine tone and relaxes the uterine muscles. So when I say uterine tone, I mean that the muscles are not too relaxed, like they can't function, they can't hold themselves, something like that happen in prolapse, but they are also not constricted, not too tight. It's like a guitar string that is not too loose or too tight, but exactly in the right tone. For fibroid, it can ease the intense cramp during menstruation and help the uterus relax when it's working harder due to the presence of fibroids, because the contractions with fibroid are really intense. It is also indicated when the pain radiates to the lower back or create urinary spasm, constriction, or pressure on the bladder. So this is about my spiel about uterine fibroid. It's more a holistic point of view that I hope help you get some insight about what's happening. Thank you for taking the time to listen to me, and I really hope it was beneficial for you. Let me know if you have any questions or you have comments in the comments below, and you know how to contact me. See you next week. Bye.